Heavy menstrual bleeding can be due to a number of different causes, or it can be caused without any pathology underneath. We call it dysfunctional uterine bleeding if there is no significant pathology causing that. We first will try to exclude the other common causes for heavy or abnormal menstrual bleeding. It can be due to tumors. The tumors could be benign tumors like fibroids. It can be due to swelling inside the uterus, something called polyps, which is thickening in the lining of the womb. It can be due to malignant nature. Obviously, that's the most serious thing to be excluded, but in most of the cases, we don't find that. So most of the cases are not actually due to serious conditions, but that's still main part to exclude. So we need try to make a diagnosis first, or to exclude the organic causes or the serious causes for abnormal bleeding. Bleeding can be due to infections, can be due to general abnormalities, like some people will have more bleeding risk due to hematological disorders, which is not common, but we still try to exclude possibilities like that. Most of the cases are due to what's called dysfunctional uterine bleeding. It means just some irregularity in the hormonal production or in the mechanism how the uterus stop the menstrual period each cycle. So we look at the possible cause for the bleeding to exclude the organic or the serious ones like cancer or infection, or benign tumors like fibroids or polyps. And if we don't find any organic cause, the diagnosis will be dysfunctional uterine bleeding, and there are a wide range of different options to treat that. Well, the risk factors for heavy menstrual bleeding will be divided, mainly depends on the cause of heavy menstrual bleeding. So there are a wide variety of different possible causes for that, and each cause have its own risk factors. So people at the age near menopause or perimenopausal age, the risk factors will be the risk of endometrial cancer, or a condition which a pre-malignant condition called endometrial hyperplasia. The risk for these cases will be patients with thick endometrium on ultrasound scan, or if they have bleeding after stopping their period, what we call post-menopausal bleeding. In other conditions, like people with benign uterine fibroids, the risk factors would be family history of uterine fibroids, or if they have other symptoms like pressure symptoms on their bladder, especially, so they go to toilet more than usual. And it can be more common in Black African patients. You would worry about heavy menstrual bleeding if it is excessive enough to make you anemic, or if you start to bleed between the menstrual periods as well. If the bleeding is controllable, it is heavy but not to the degree that making you anemic, then it will be a personal choice, really, how much each one is different. What do you think it is heavy for them or not? So it will be very subjective. But for all cases who have actually lead to iron deficiency anemia, or the people who have bleeding between their menstrual periods, we need to exclude other organic causes of bleeding. It might indicate just dysfunctional problem in the way the ovaries and the uterus work, or it might indicate other more serious conditions like benign tumors, fibroid uterus, infection or inflammation, or on the other extreme end of the spectrum, malignant disease, cervical or uterine